and welcome. I am so excited today because I have an amazing, dynamic guest. She is just an awesome speaker and advocate for her son and other children who have been diagnosed with autism. And I want her to share her story because it is so powerful, so compelling, and it really speaks to the importance of early intervention. I mean, she's become one of the biggest advocates for early intervention because she has seen firsthand how impactful it is. So I want to welcome Miss Marlita Bass.
Hi, thank you for having me, Miss Theresa. I really appreciate this opportunity.
Oh my goodness, you are most welcome, Marlita. I just, like I said, when you speak, you do it with such passion, and you've become so powerful in this realm as an advocate and just somebody who speaks out for what our children need, our children who are at
Thank
risk
you.
for autism, or have been diagnosed with autism. So, yeah, I just thought it'd be really important to have you here. Excuse me. So I want you to start out by, because I want people to know where you came from, where this all started, how this all started, right?
Okay.
Our journey together and where we are now. So if you can start with that story of when, Amir was born and, just take us through a little bit of your journey.
Sure. And like I say, I apologize about these allergies that have been bothering me. So I'll do my best to speak loud enough. Like every mom who has her first child, she's excited that she's going to be expecting a baby, and you read all of these books and what to expect when you're expecting. Well, I didn't read about this chapter. Amir was born at 37 weeks. He didn't spend any time in the ICU, just a regular happy baby boy. And I started to realize that he stopped babbling. Like he would do things that other kids didn't do. And having experience working at a special needs daycare when I was 18 years old and in high school, I just realized that this is not how typical little boys are supposed to behave, or kids in general. And you
Mm,
always hear, well, he's a boy and boys take longer and boys are just lazy. That wasn't a good enough excuse because still he wasn't trying. Like he
mm,
started off fine, but then after appointment, he started to regress. And I was thinking, okay, I saw a fire truck go by and my son didn't even respond to that. And normally some little kids would put their hands on their ears or they would start screaming. He didn't do that. And I'm thinking, okay, this is a problem. Like something's wrong with my son, you
mm,
know. And sometimes, for us, the doctors didn't believe what I was saying. I said, I don't think he can hear. Like I've never had a child before. I'm a first time mom, but this is not what typical little kids do. And he would start stacking up his blocks, or he would start playing with the cans in the kitchen, and he'll stack them up or line them up against the ground. And he would have hand flapping, or he would start poop smearing. Like he would just do odd behaviors that I've never seen before. And the best friend at the time, Robin, was telling me, she was like, look, I know you never heard of this before, but I think your son has autism, and it wasn't until I brought that to the doctor's attention that they realized, okay, wait, he does have autism. Like I just thought, what can I do to this little boy who's doing these abnormal behaviors? Like, who do I speak to? They made me start to feel paranoid, like, or overprotective because I've never
mm.
seen it before. And it's just been a journey from where we've been to where we are now, with him not being able to verbally communicate his needs. Me buying flashcards and trying to show him how to speak. Just it has been a long, long battle and a long fight.
Right. Yeah. So let's go back a little bit. So here you are, all of this is happening. What does that feel like? Because I have heard so often that parents go to doctors and exactly what you said. He's a boy. He'll develop later and all this and that and all these reasons that they tell you. Why don't you just give up and just believe that, okay, maybe he's a boy and he'll develop eventually?
Well, I didn't give up. I didn't give up because, I know the statistics for young Black males in America who are illiterate. Like I wanted my child to have the same opportunity like every other little boy and girl. And we know
Mhm.
that education is the key. So if you're not being motivated or challenged educational wise, what's going to happen for your life? Like I wanted more for my son because I know that I'm not always going to be there. And as a parent, it's my job to prepare him as best as I can for the future.
Absolutely. And then understanding that no matter what, nobody's going to treat him the way you do. So if you
No.
don't arm him with the information, if you don't arm him with the skills, then what's going to happen later on, right?
Right. He's going to be left behind. Like no one's going to baby you like mom. No one else is
Right.
going to do that. No one's going to
Yeah.
cut your vegetables up for you or peel the skin off the apple. That's a mom thing, you know?
Exactly. So we want to teach them those skills so
Yes.
that, again, God forbid something happens, he has the skills. He's not
Yes.
depending on anyone else for those
No.
skills. Yeah.
No, it's
And
true.
I'm glad you had that in your head. You felt that, the
Yes.
importance of all of these skills early on. Otherwise, we don't know where he'd be today.
Oh yeah, early intervention is the key. Like once you realize there's a problem, you have to be proactive. Like I became upset. I became sad when my son received his diagnosis because they only told me the problem. They didn't tell me the solution. And I've had a lot of questions. When will he speak? When will he be potty trained? And they didn't have an answer. And it was up to me as a parent to be proactive and become empowered to motivate my son to get to answers, to
Absolutely.
find
And
you.
yeah. Right. The thing is, though, doctors don't know what they don't know because, we go to them, and thankfully you had all the symptoms and you were able to discuss those with your doctor. However, they don't know what they don't know. They're not as educated regarding autism as we would think, even
Yeah.
in this day and age, because we're still hearing a lot of what you're saying. I have parents, all the time. I took them to the doctor. The doctor said to wait. I was like, no, if you see something, a sign. If your child is 6 months and they're not making eye contact, they're not babbling, they're not engaging with you, they're not laughing, do something right then and there, because it's easier at 6 months than it would be at 6 years or 3 years or 2 years. Like it's much easier the earlier you start.
No, no, I agree. And you have to write down the questions that you have for your pediatricians. You have to, I feel like a case manager for my own children, like I'm asking them, are you reaching your accolades? Are you reaching your goals every month? Where should you be at proper development? How can I help you achieve those goals? Even if it's
Mhm.
modified, I still need to make sure that, you can achieve these goals to the best of your ability.
Absolutely. So, what led you to early intervention?
Well, so, my son at the time, he had chronic ear infections. He had 50% hearing in both ears, and the doctors couldn't tell me whether he needed cochlear implants or surgery for his tubes. Like, no one had answers, and I really had to fight. I had to fight with insurance companies. I had to change pediatricians. I just want answers to be able to help my son. And with this being America, the greatest country on earth, I'm thinking, okay, we have the greatest medical systems, doctors, you know, it should be easy, but it
Mhm.
wasn't. And I knew that he wouldn't have much of a future. If he didn't receive early intervention before kindergarten, he would be behind. Like, I mean, further behind than he would be now. And I just knew that, I saw a brochure at the doctor's office and it spoke about early intervention and it asked questions about, is your child babbling? Does your child find interest in things that a typical child wouldn't, find interest in? Like instead of playing with the remote control car or the toy car, he's counting the wheels on the car or he's, counting how many checks are on the paint, whatever. Like paying attention to small details that a normal 2 or 3-year-old wouldn't. And
Mhm.
I just, I started doing research on YouTube. I started joining parental groups on Facebook. And that's when I didn't feel alone anymore. Like more parents were saying all of these behaviors that their kids had. And it sounded just like my story. And then I realized, yes, my son has autism.
Mm. Yeah, yeah. Often it's up to the parents to, I mean, like with everything else, right? You diagnose your
Yes,
child, right? You look at the symptoms and you
yes,
diagnose your child, and then you take that information to your provider, to your pediatrician,
yes, that's what I
and
did.
then they do, they do all the things. So you did exactly all the
Yeah,
steps. And something else I really admire you for is that you put your son, even though your son had a diagnosis of autism, you chose to put him in a daycare with just every other child, right? Which is
yes.
beautiful,
Yeah,
and
we did it. We wanted him to have the only way that you can meet your IEP goals or to be around kids who do not have, who are typical developing. Like that's the way that you learn how to adapt to society. And it wasn't helping him being in self-contained classes. He needed to know how to interact with people regardless and how to feel comfortable in a situation where there were not kids who were like him.
yes. And the reason I bring this up, because so many parents I speak to, they're like, well, I'm going to wait till my child is talking to put them in a regular daycare. I'm going to wait till this and I'm going to wait till that because I don't want them to come home. I don't want something to happen to them and then they come home to me and can't talk. And what would you say to that?
It's very funny that you say that because I actually had a button on my child with mine with it said, "Hi, my name is Amir." Then it had my phone number and it said, "Please call my mom if you find me. I'm speech and hearing delayed." Like I know
Yes.
that seemed excessive, but I wanted to make sure that my son was okay. Like I didn't know how to advocate for him and just I don't know, it was just uncharted territory on how to help him be better if he couldn't speak.
Right. But
I
how
just
did you overcome the fear of sending him to a regular daycare? Because so many parents have that. And if you could, as a parent, if you could speak to that, I think that would really help some people make a different decision.
Well, for me, it was having strong faith. I had to have strong faith. Uh, and I actually for him to go to regular daycare, I made a connection with the teacher. So I always say, always try to find a person on the inside. Find someone who you can speak with to keep an eye on your son. And that happened to me. Like, our daycare, they kept an eye on him. They would communicate with me. Uh, just just letting them know that I think my advocating for your child, letting them know that my child deserves the same opportunity. I'm a hands-on parent. I will be there if you run into any type of questions or he behaves a way that you don't understand. Reach out to me and I can help you. I offered to volunteer inside the classroom, and I have anytime they had events, just to let my son know and let the school know that I'm here to work as a team with you guys. Like, we have to work together to help my son. But I was
Absolutely.
scared. I was scared because you read all those horrible stories about abuse and your kids, and I'm thinking he can't tell anybody anything. What
Right.
do I do? Just blind faith and letting the people at the daycares know that I'm there for my child. Like, please reach out to me.
Right. And the other benefit these days, pretty much every daycare has cameras in every room. So you
Yes,
can check in and see what's going on. So, because we know children learn best from their peers. If they're not with, like you said, typically developing peers, they're not likely to learn the skills that they would need to adapt in this world, right?
correct,
You
correct.
yeah, because being with other children who have the same diagnosis, who present with a lot of the same behaviors and skills, how will he get that step up? How will he learn
Right.
those skills that he needs to?
That's correct.
Yeah. So yeah, so that was, like I said, I really, really wanted to bring that up because again, I want pa parents to get over that fear,
Yes.
of not sending their child. And if it comes from a mom, because, coming from me, it's like, well, but coming from somebody like you who has been there and can speak to that, and, um, I think it's just more powerful.
Thank you. I mean,
Yeah.
he's been to multiple daycares because I think a lot of fear from other parents is to have other kids after you have a child who's on the autism spectrum. And that was one of our fears as well. But, we had a little girl after we had Amir, and they're 3 years apart, so they went to the same daycare.
Yes.
And, I just, it was hard having an infant who, of course, can't speak, and then having a child that's nonverbal. And they actually both have been to three different daycares throughout their entire life. So, of course,
Mhm.
going to a new daycare, introducing yourself, introducing your child, explaining to them about the diagnosis, and just open communication and transparency is what's very important.
Absolutely. It really is because then people know how to help.
Yes.
And, and I am thankful that the daycare allowed us to go in to help to work with Amir, to
Yes.
educate them, to educate the staff and to help Amir with the process of, socializing and
Yes.
advocating for himself and, doing all those amazing things. So that's another key point too, because a lot of people are not trained to work with children with autism. They don't know what to do. And a lot of times they
No.
may do things that don't serve the child, right? And I'm not saying these are negative things. They just don't know what they don't know. And they might do something like there are times that I had to tell the teacher, not right now. He's having a
Yeah.
tantrum, not
Thank
the time to
you.
hand him a candy.
No, because you're rewarding that junk behavior. I mean, it's the same thing parents have to think about. Just because they have a disability doesn't mean you treat them any different from a regular child because they still have regular child behaviors.
Exactly.
It's the same thing.
Yes, yes. And it makes me think of the Pygmalion effect, which says if your child will meet your expectations. So if your expectations are down here because your child has a diagnosis, then they will behave like they have a diagnosis.
Yes,
If your expectations are, listen, yes, that diagnosis, it's a label. It does not determine your child's future. It is simply a label. Just to
yes,
say your child may need these interventions. They may not. However, it will help you, avail yourself of services that you can use to help your child. So, don't
yes,
get discouraged. And I know, like you said, when you first received that diagnosis, you had a lot of different feelings come up, right? So,
yes.
yeah, it's scary because you just don't know. And yeah. So tell me, when your first step, when you put your toe in early intervention, what did that feel like?
Well, I had hope. I had hope that it would be possible for my son to catch up because even though he was 3 years old, chronologically, his reflective language age was one. So I mean,
Mm,
imagine having a 3-year-old physically in this big, beautiful body, and then communication skills of a 1-year-old. That's hard. Like, how do you catch your child up to speed? And once I started hearing the stories of parents in early steps, it made me realize that I'm not alone, and this is possible, but it's going to take a lot of work. This is not going to be easy if I want
mhm.
for my son to have the same opportunity. But it felt great because they would send speech therapists out to my son's school through early steps, and they would identify with a chart where he's supposed to be linguistically, where he's supposed to be with his social behaviors. And we were given work to have at the house as well. They have a library where you can check out material to help your child develop those skills and board games. So just you know, community resources for parents of kids on the spectrum to help you teach them social skills. It felt great. It felt like I was going to be able to get somewhere and have my questions answered.
Awesome. Because you know what? Going it alone, I don't recommend it.
No,
You know,
no.
And also, you were realistic, right? There's some parents who like, well, because they hear certain things, he'll grow out of it, or this will happen, that will happen. And by the time they get help, their child is 5, 6, 7 years old and set in their ways. And I mean, it's not that it's impossible for change to happen. However, as you know, it would be more difficult.
Yes. Well, I've noticed that because even there's some behaviors that I'm working on with Amir now. He's 8, he'll be 9 in February. And I mean, a basic thing, being nice to your sibling and sharing. That is a skill that all parents are working on, whether you're on the spectrum or not. So,
Yeah.
you know, I had my son wear the sibling shirt, and I don't know if people know about that at home. Like, the oversized 3XL t-shirt that you guys got to wear together and walk around the whole yard in because because you don't want to behave. So you have to wear the sibling shirt all day. Let's just say he's nicer to her. But
Wow.
but there's still things that our kids go through, even though they have a different way of learning, or even though they have a diagnosis, that doesn't mean you're not going to have typical behaviors.
Exactly. And you want those typical behaviors, right? Because
Yes,
then
yes.
that
I
tells
would
you,
worry if he
hey,
wasn't
my
being mean to his sister.
yeah, awesome. So, sorry, I kind of spoke over you a little bit. What was the last thing you said?
I would worry if he wasn't being mean to his sister, or, doing little behaviors, because that's part of growing as well.
Yes, it certainly is. And it's refreshing that that's happening. So awesome. Now, tell us a little bit about, so you talked about, the early intervention with early steps and that, and then you moved on to ABA therapy.
Yes.
Why did you select ABA therapy? Because there are a lot of parents who are not comfortable with ABA therapy. So why did you select ABA therapy?
Well, so my son's pediatrician at the time suggested ABA therapy, and I've never heard of it before. Like, I've heard of speech therapy and I've heard of occupational therapy, and I say I've never heard of ABA. But he said it's an intensive form of basically all the therapies put together, but they can actually show you how to communicate in your community. So he was saying that speech therapy, it's occupational therapy, it's physical therapy, all rolled into one. You know, in the community for you, and it can help your child. He said we've seen high positive outcome results on it, and he thought it'd be beneficial. So at that point I was tired. I'm like, look, I will try anything. I just wanted answers. I just wanted help for my son. So I said, whatever he needs to do, we'll do it. We'll try it.
Nice. Yeah. And I'm glad you did. Otherwise, we wouldn't have met.
I'm glad we did. I mean, and as any parent, you have to take that chance, take that risk. What can you lose? And now my son, he's doing amazing. I mean, he's when I first met you, Miss Theresa, he wouldn't even ask for water. He couldn't communicate his needs to go to the restroom. He he could only speak 10 words, and that wasn't even in context. And I remember you saying, Marlita, he needs to ask you for a glass of water. And in my head, I was thinking, this lady is crazy because he can't even talk. How is he ever going to ask for water? But you have to have that expectation. I didn't have any expectations for my child because I had that guilt, that autism guilt or that disability guilt, where I hated to see him cry. So I would just give him whatever he needed because I felt that was easier.
Yeah, yeah. And what did you learn from that?
That's not easier. Do not give them what they want, because he was smart. Even though he was delayed, he was very smart. And I tried this technique at first where if he would get into trouble, I would hug him and say, "Okay, buddy, you're going to do better." Well, every time he got into trouble, he would realize that this is my way out. So he would say, "Hug." And I started picking up, like, wait, this little guy is really smart. I think I'm going to need you to do the right thing. Like, he knew.
Mm, yes, yes. Your camera's not on.
Oh,
You
okay,
there?
hold on for one moment. It's acting up. One moment.
So yeah, and that's the thing, but interesting, right? He learned to say hug because that was his out, right?
Yes, that was his out.
And then wouldn't ask for water because what benefit was that? He was just given water anyway, regardless. Like you
Right.
would anticipate his needs and give him what he wanted. And would he ever learn to talk if you continued to anticipate his needs?
No, he wouldn't try. He wouldn't even put the effort. If I was always giving you a glass of water, would you ask for water? Because automatically you know that if I sit down at this table and get food, she's going to give me water. So why should I ask?
Exactly. So tell the story about the water thing.
Oh my goodness. Hold on for one moment, Miss Teresa. I'm going to tell you about that story. Just 1 second, please. Hold
Yes.
on. I'll let you tell them how you met me while I go ahead and grab this so I can show you this
Oh,
picture. So I'll let you tell
okay.
everyone the story.
All right. So, Anyway, as a behavior analyst, I was called to assist Marlita and her family with her son. And meeting him, I thought, oh my, I mean, just the cutest thing ever. And he, like she said, he learned how to get into what he wanted and how to get out of what he wanted. However, his language was not functional. He was also what we call hyperlexic. He could spell Nickelodeon and Geico. And I'm like, who spells Geico? But anyway, he could spell like there's no tomorrow, but he couldn't ask for water. So it was interesting one day, we had the bottle of water right there and it was sweating. And instead of asking for water, he got the sweat from the bottle. And that's how he
No,
quenched thirst, which was hilarious. And but what we did, he would just say a string of words, and every time he said water, because water would be in there somewhere, we'd give him the water. So then he started associating the word water with, with the liquid which we presented him with. So then he started asking for water, right? Some people would say, oh, well, that's so, it's, I don't know, mean or whatever. It's not. It's actually helping the child meet that need. Because had we not done that, had we not taught him to ask for water, had we not held out when he was thirsty, right, when that need is there, to teach him to ask for water, when would he ask? He's not going to ask for water after he's drank like 4 glasses, right? He's going to ask for it when he is thirsty. So we have to capitalize on the fact that of when water is more valuable to him, right? Water is not valuable after you drank like 4 cups. It's only valuable when you're thirsty. And I know I've said that, but I just wanted to emphasize that. It looks like we've lost her, but I'm sure she'll come back. So eventually he'd ask for water after that. And then we taught him to ask for other things. So we made it, we used the things that he really liked. And that's what we taught him to ask for first, because he'd be more motivated to ask for those things because he likes them, right? And he wants them. Whether it was a cookie that he wanted, or just anything else that he liked, we requested we taught him to request those things so that he could feel that this talking thing, it works, right? Because if he doesn't have to ask for it, then what's going to happen? And we avoid anticipating needs because when we do that, children don't learn, they don't acquire the skills. And there's a study by the Kegels. They have a clinic in California, and I don't know if they still do, but they did. They had a clinic in California, and they worked with children on the spectrum. When these children were discharged from their clinic, you could not tell the difference between them and a typically developing child. However, years later, they thought, oh, let's just see how these children are doing, right? They were moving out of offices and they had all these not these VHS tapes. And they were like, I wonder how Tom and Susie, and I'm just making up names, but their clients, they were wondering how they were, all these years later. So they found them. They found some of them. I'm not, they found the clients. And what they found was they located them. And what they found was some of them were in college, university, getting higher education. Everything was wonderful. Some were working, beautiful. Others were in homes being cared for, right? They were not able to care for themselves, even though they left this clinic and they were fully functioning, able to do whatever. The difference is they were not allowed to initiate. And what I say by initiate, ask for what they want. They did not ask for anything to get their need met. They didn't know how to ask for help. They did not, because what happened, the parents would anticipate their needs, right? And say, well, Johnny, it's been 2 hours, you must be hungry. Or Susie, do this or do that. And, you need to and you should, and all of this, instead of allowing the children to say, I'm hungry, may I have something to eat, please? Or indicating the fact that they need to have this need met, whatever the need was. So they developed pivotal response treatment because of this, right? Realizing that initiation is a pivotal behavior. And what they mean by that is it gets you other things, right? When you initiate, you can get your needs met. It's one behavior that gets you all kinds of amazing things, right? So when you initiate, you learn more too, right? You build these children develop, or we all do develop pathways in our brains, and we no longer have to sit and wait for someone to provide a need. We can ask for that. Now, when a child asks you for something, and age appropriate, of course, yes, there's a point where you get it for them, give it to them. And there comes a time when, you know what, they're old enough that they can get it themselves. They can meet that need for themselves because ultimately that is what you want, right? What will happen if you continue to anticipate and do all the things for your child? And then later, again, like these children who were in homes being cared for, they're not able to function independently. Nobody's going to do what you do, right? Marlita said it. Nobody's going to do what you do. Nobody's going to, anticipate your child's needs. You're not going to say, oh, you must be hungry. It's been 2 hours or whatever. They're just going to be like, okay, well, he'll tell me when he's hungry, or expect that, as a 5, 6, 7, 8, 9, 10-year-old, they will be able to share that. I've worked with teenagers who did not know how to get a need met. They didn't know how to say they were hungry. So have a tantrum because that's what they know. Even though they had language, hunger was not something they identified with, or thirst was not a feeling that was described to them, right? It wasn't a feeling that they understood. So it's really important that you teach your child when they're having this feeling. So, oh, you must be thirsty. Here's some water. So when they ask for water, you want to label that feeling as thirst. Or when they ask for food, you want to label that feeling as hunger. So they associate those feelings and are able to ask for that and get their needs met. I hope that made sense. Okay. Hey, Marlita.
I am back. I'm in a really rural area, and Amir's looking, so I'm knocking on the window, but technical difficulties.
We call that life. Yes. So I shared this story about the sweat on the bottle.
Oh my gosh, yes. He was adamant about not speaking.
Yeah.
Excuse me,
Yeah.
Amir has a question. Yes, Amir.
Can we play behind you?
Hi, Amir.
They're after school time. Go ahead, Miss
Yes,
Theresa.
yes. I know. And I'm telling people, you have to be in the car because it's the quietest place, but not anymore.
Yes, I can't even have peace in the car.
Oh my goodness. Well, we make it work, right? It's life.
Yes, yes.
Yeah. So tell us a little bit about your journey in ABA.
Okay, so when we started ABA therapy, I joined some parent support groups, and some people were saying that, ABA therapy wasn't for them. Some people said ABA therapy was actually all that they needed. So I decided to test that theory myself because while getting ABA, we were also getting speech therapy and occupational therapy at school, and he was also getting speech therapy and occupational therapy at a rehabilitation center as well. So we were getting therapy from everyone, and I was comparing their styles and, you know, making sure that I could implement the same things you were teaching at home as well. But the journey, it's been a long journey. There's been nights where, I went to bed mad, my partners went to bed mad. We're mad at each other because, we're trying to figure this out. I'm mad at the other kids, and not so much mad, but just frustration because just nobody wants to see their child cry, and you develop this guilt. But by giving you what you want is not the answer. It's not helping with anything. If I
Yeah.
give you what you want because you're crying, the world's not going to be that way. The world's going to escort you out, or they're going to ask the police to escort you out. So, just learning how
Okay, we lost her again. So anyway, I'll just continue what Marlita is saying. It's important. So the thing is, we teach replacement skills. Children need to learn how to ask for what they want. Once they've started tantruming, there's nothing you can do really but to keep them safe. Because if you try to give them what they want in the middle of a tantrum, they'll learn, oh, all I have to do is tantrum next time. You know, I'll share a story with you. There was a family who I worked with, and the little boy asked for something, and it was not available. So there was a tantrum. I didn't get a chance to say when it will be available or what alternative we were going to present him with. There was not that opportunity. And at this time, he was 10. He was a 10-year-old who was very echolalic. So by that, I said, I'd walk in and I'll call him Tommy. I'd say, hi, Tommy. And he'd say, hi, Tommy. And, so anyway, within a couple of months, he was actually having a conversation. He was no longer echolalic. However, in the beginning, tantrums were a thing. So the first time I went there, he was having this tantrum because he wanted something and couldn't have it. Anyway, we were honestly, like I said, this is 10-year-old. I had a bump on my head when we were done, biting. I mean, he attempted to bite me, kick me, slap me, you name it. And the key is to remain calm, right? And I always tell parents, the first thing you have to do is be calm. So an hour and a half into, actually maybe it was more than an hour and a half into it, mom was like, oh my gosh, I can't believe it's going this long. I said, well, what do you normally do? She goes, oh, by an hour and a half I give in. And I thought, well, that's why we're almost, and it lasted honestly 3 hours. However, it never lasted 3 hours again. The next time the tantrum was 20 minutes. The next time it was less than 5. The next time it was like, ah. And I was just like, yeah, that's okay. You can express yourself. It's okay to be upset. We'd label those feelings for him. And that was it. The other interesting thing is people think that when a child is having a tantrum, they are out of control. I beg to differ. So this little guy at 10 years old was having this tantrum, and he would scream and cry and then call, Grandma, help me. Right? He was echolalic, but he would say, Grandma, help me in the middle of a tantrum. I've had a 2-year-old who actually just Wednesday night, I went to see her and she was having a tantrum. And, she used to throw herself on the floor, when she had a tantrum. Now she gently lowers herself on the floor. Her head doesn't even touch because actually one day, she was having a tantrum, threw herself down, and she hit her head and it hurt. Now, I would rather that happen at 2 than happen at 10, 11, 12 because she's learned, oh goodness, that really hurt. I can't do it again. Imagine if the 10-year-old had willfully hit his head against the wall, what would have happened, right? Thankfully, he didn't do that. That wasn't in his behavioral repertoire, so that didn't happen. But this 2-year-old who mom, every time she started to tantrum, mom would start panicking. And I had to tell her, stop, look at her. Take a look at her, how gently she's lowering herself and that her head didn't even touch the floor. I mean, I was like, she needs a fainting chair. And the cry was obviously, the parents like, she's not upset. She had learned that crying got her way. And that's what she did. Then we taught her a word to get what she wanted. She said that word. Actually, she didn't even say the whole word. She said an approximation to the word, right? She knows how to say it. She said it many times before. She said it that day. However, she cried and chose not to because mom said, well, say whatever and you can get it. And she said no. So the mom said, well, if you don't want to say it, you're not going to get it. So then she made an approximation to that sound, to the word, and she was delivered what she wanted. So it's really, really important that we not reward those behaviors. And it's not, not every child is going to tantrum, right? But it's really important to motivate them to say the word and to say the thing, because if we continue to reward them when they're having a tantrum, then they will learn. It's just like I was in a training with Dr. Catania, and what he said was, it's like the child who's ignored until they throw the chair. So then now the first thing they do is throw the chair because, the second they threw the chair, you're like, wait, stop that. Don't do that. Tommy, what are you doing? Blah, blah, blah. They got the attention. They got what they wanted. That need was met when that happened. So a lot of children will, a lot of children I've worked with because, they present with behavioral concerns, they do these things, they engage in behaviors, and they learn very early on as well that crying will get me what I want, or doing whatever will get me what I want. So we want to be very careful that we're not rewarding these behaviors. Right, we're not giving them what we and again, they're not suffering, they're very much in control. It's just we have to be careful that we're not, that we're teaching replacement skills, right? Teaching them to ask for what they want. And the second they ask for it, we're giving it to them. So they associate the word with the thing, just like we did with Amir and water. He would say water in a string of behaviors, in a string of words, and as soon as we heard it, we always had the water ready. Here's the water. Or if it wasn't ready, we say, okay, we'll get water. I know you want water. I'm going to walk to the kitchen and get some water. Okay, I'm getting that water. Well, I'll be there soon with your water. Just so he knows that he was not ignored, that that water is coming. That need is going to be met. We want to make sure that crying is the hardest thing he has to do to get what he wants, and talking is the easiest thing to get what he wants. I hope that makes sense, right? Because we want to make the effort for getting the needs met so easy. Like we want to make it like as little effort as possible to get a need met, and as much effort, like increase the effort when they engage in a challenging behavior. So welcome back, Marlita. You're muted.
Hey, can you hear me now?
I can hear you now. Yes.
Okay, my apologies. We're in a really rural area, so it's not the best signal. But I'll try to
Um,
be fast. Somebody has to hear this message. Somebody needs some encouragement because all this problem that I'm having with my signal.
right. And we know it even started before your signal because you almost didn't make it today.
I almost didn't make it today. But I guess, I
Right.
mean, there's a parent out there that needs to hear that you're not alone. Hang in that fight. I mean,
Yeah.
what did we receive? How much? So from 3 years old to, see, seven? 7, he received 40 hours of ABA therapy a week. So you've
Yes.
always been in my home. And we've had dinner together because you showed me how he should behave at the dinner table. These are social skills.
Absolutely, absolutely. And he's tried new foods, and because that was also another
Yes.
struggle. He was a very picky eater, and we worked through that as well. He wasn't toilet trained.
No.
We a lot. So when people think, oh my goodness, that's a lot of time, we were working on different skills. So,
Yes.
he started talking and interacting. And of course, it always needs to, we can always grow, right? When
Yes.
we're yes, he's talking. Okay, now we need to work on all the different nuances of communication, right? Not just asking for
Yes.
what he wants. Can he infer? Can he, take
Can he point?
perspective?
Can he point to it? Can he make
Yes,
a
yes,
sound? Or just letting you know, communicating. Because for a long time, Amir was the pickiest eater. I mean, as a baby, he ate everything, but there was some reason, like as he got older, maybe four, 4 or 5, he refused not to eat. He refused. He didn't want to eat mac and cheese. He only wanted chicken nuggets, rice. He wanted rice every day, and he wouldn't venture out. And I thought to myself, he didn't like vegetables. He didn't like fruits. And I thought to myself, how are you gonna go to school? Like I had to bring him lunch. And who's gonna stop what they're doing as he's older and bring him lunch? Like that was something that I had to realize. Like I was setting him up for failure. And there were days where he wouldn't eat the school lunch. And his teacher brought it to my attention that he's not eating school lunch, but he's making a choice. There's something that you can find in that cafeteria on that plate that you can stomach and manage to eat. But it's just been such a journey with him eating, with him being toilet trained. I wanted him to attend a karate summer camp, but who's gonna change your, pull up and make sure that you're changed at a summer camp? You're beyond that age. So there were a lot of factors limiting our ability to have a typical childhood. I
Yes,
know that
and
was
I
a lot.
no, it was, and it was great. It was great information because there are a lot of, I worked with a 7-year-old who was not toilet trained, and I thought, oh my goodness, you know, it just makes life more difficult. How will they have
Yes,
friends, right? Because my thing is, you want your child to enjoy a full life. You're at the park, with your 7-year-old who's not toilet trained, who just had a bowel movement, and then the other children around, what are they thinking? What are they saying? So
yes,
it's really important that children learn these skills so that they can function independently, you know, and it's not, this just came to mind, Marlita, because a lot of parents are like, well, that's their personality. We don't want to change their personality. What do you say about that? What do you say to that?
well, so here's a horrible story that happened because my son was 3 and we had a doctor's appointment, a dentist appointment, and he was still wearing pull-ups. And he had a bowel movement, and there were kids who were in the waiting room playing with him, and they were like, "Ew, he stinks. Get away from him. He's weird." And they would not play with him. And that was such a heartbreaking moment because I know that kids can be mean, and how horrible would that be to be, 8 years old, 10 years old, 11 years old, still, not toilet trained. And, how does that affect your self-esteem? How does that affect your mental health? There was so many things that were correlated to it. I said, okay, so I have to figure out everything that I can do to get him toilet trained. And that meant giving him Skittles, every time he went to the restroom, having the app on my phone, the See Me Go Potty app on the iPhone, like just creating that social story, showing him how to wipe. It took longer than others, and of course, some parents, oh, he's a boy. Boys take forever anyway. But how long do you have to wait? How much time goes by before you say, you know what? I need some intervention. I need some help. This is beyond what I know, my expertise.
Right. Yeah. And that's the thing. I'm glad you spoke about, the child's self-esteem, their dignity, right? Because that's the thing that really gets me because, parents want to wait because they don't think they're ready. Now, my thing is the longer you wait, the more difficult it gets, right?
Yes,
So if we do it sooner, we'll preserve their dignity. You
yes,
know, they'll be able to do these things because I mean, I'm like, I don't want anybody coming and wipe me because I have the ability
no,
to do it. Right? So if I
no,
learn, if I teach a child how to do that, how good will they feel about themselves?
yes. Now, I do want to say this. I'm in a rural area, so if it cuts off again, I just want parents to understand that you have to advocate for your kids. You have to ask the questions. You have to do the hard work. Ask yourself, it's cute now or it's manageable now when they're 1 or 2, but how can I manage it when they're 5, when they're 8, when they're 10, when they're 15, when they're 25? At what point will they be able to be independent in life? That's something that you always have to put to the back of your mind, is that you're not always going to be there to take care of them. How can you make it easy for them to take care of themselves?
Exactly. And it's funny because I got into early intervention because my first 2 clients were adults. And I saw the quality of life that they had wasn't optimal for them based on the skills that they had. The first one was a young lady of 32 and who wasn't toilet trained. And I was working to toilet train her. And, because she was in a diaper and everything. And I thought toilet training would be great. And she would sit on the toilet and cheer for herself when she produced anything. And then I heard, well, it's just easier for us to change her diaper. So that's not that important. And I thought, oh my goodness, why am I here? That was a job that I wanted to leave because I didn't feel that I was serving this client. You know,
Yeah.
the other one, was a young man who didn't feed himself. At 42, people still fed him, and there was nothing wrong with his limbs. The thing is, he would hit the side of his head so hard that everybody was scared. Oh my goodness, he's going to split it. But if he's been hitting his head all his life, I don't think he can feel anything. I think the sound was worse than anything else. after he did it 5 times, and then he would, push the yogurt to me so I could feed him, and I pushed the yogurt back to him and he pushed it back. After he did that for about a minute or two, he just grabbed that cup and started to eat. And I thought,
Yes.
it's not that you couldn't. But if people are going to do it for you, then,
Why do
why
it?
not? Yeah, but why not free yourself up as a parent, as a caregiver? Why not free yourself up so you're spending quality time interacting instead of, these daily living skills that would be best served if we teach our children to do, right? Those in our
Yes.
care, if we teach them to do, as opposed to doing everything for them. And then their self-esteem is wearing away because now everybody does anything, and they start to feel like, okay, well, I don't have to do anything. And that's not helping them, because if something happens to you, what's going to happen to that child? Nobody's going to do what you do.
No, no, they're not. That's the hard part about it. You have to you have to be able to understand that, they need even the minimum. I mean, Amir can make a peanut butter and jelly sandwich, with plastic utensils. That's a life skill because if you can't do anything, at least you can make a sandwich. He wasn't asking for water, so we had him carry around a water canteen. If you're not going to ask for it, you still need to drink it.
Yeah.
He wasn't able to buckle his pants. So I brought the magnetic belt, like at least to give you that responsibility to work your way up. Um, he can tie his own shoes. And that was a lot of work. That was a lot of work that went into, you know, putting it like if you want to watch something on TV or one of your favorite shows, you have to attempt to tie your shoe. Does it have to be perfect? No. But you have to put the effort in.
Mhm. Yes. And then he was rewarded with the show, which is amazing, because that is a great skill to learn. Because, at 10, 12 years old, I see students who are in grade 6, 7, and 8 who don't know how to tie their shoes, and there are people doing it for them. And I thought, no, we need to have a class in shoe tying, because the world is not, you can't just stop in the middle of the street and ask somebody to tie your shoe,
No.
so it's important to learn those skills. You know, um, I just think back, Marlita, to all the tantrums and all the
Oh,
things.
oh my God. I never
Yeah.
thought we would make it past that phase. I didn't even know what to expect because he cried about everything. He was like nothing made him happy with food, with going to new places. If your tire broke down, then he would be upset that we weren't able to make it on time. Like these are things that can happen in life, and it doesn't mean that the world stops or you have to have a meltdown about it. We're trying to teach him how to build a bridge and get over it.
Absolutely. Now tell us a little bit about Amir today.
Okay. So Amir today is doing amazing. He was in self-contained ESE classes, and I advocated for him to get out of that so that he can spend more time around his peers. So right now he's in the third grade. He'll be 9 in February. He's actually in gifted classes. He made the honor roll, but I had to put that expectation for him to do your best to not give up.
Mhm.
He is toilet trained. He feeds himself. He's able to go to school and decide what he wants. Like he's making his own choices. No one's bringing his lunch tray to him and giving him a tray. He has to pick what items that he wants.
Yay.
We go to new restaurants every week, so we have a little activity where we call it restaurant, ratings. And we basically go to different restaurants and I let him look at it beforehand and then we give them a try, we give them a star. Just
Nice.
something new.
Awesome. Yes, you're not shielding him from that. And, it made me think of Temple Grandin, who said, and I don't know if everybody knows, but she's the most famous person I know with autism. She is Dr. Temple Grandin. When she was younger, she was a hand flapping, non-vocal child with autism. And today she's Dr. Temple Grandin, author and speaker, and just she's done amazing things. And she said the one thing, like one of the things that she's really thankful for is that her parents exposed her to new experiences,
Yeah.
right? Because so many children with autism, their parents are behind doors. They are imprisoned in their own homes because, well, if I go out, he's gonna this, and if I go out, he's going to that. But he's not going to learn if you keep him behind those doors, and life is not going to happen. What happens when there's the doctor's appointment or if there's an emergency and you have to leave? So that makes life really challenging. So it's really important. Expose your child to new experiences. Help them through it. Like Marlita said, they talk about it beforehand to help him with that transition. You know, in the beginning, Amir would not be able to I shouldn't say not be, he tantrumed if we put the alphabet out of order. If numbers were out of order, he would tantrum. Like she said, he tantrumed a lot, many times a day, and over just things that you would be surprised at. And today, like she said, he's in gifted classes. He plays basketball. He's on a basketball team. He goes fishing with his family. They live on a farm. He helps care for the animals. He has friends and a best friend at that. So he's interacting. It's hard to tell the difference between him and a typically developing peer. Not that that's the goal. The goal is for him. And Marlita always said, she just wants her child to be at his best, to reach his best potential, whatever is the highest potential for him, whatever is the highest level that he can get to. That has been her goal. That has been her dream. And she's realizing that. He loves talking about the planets, and he'll say, to her, like she'll say something, he's like, no, mom, that's not right. He'll correct her, right? Which she just loves, right? This was a child who didn't talk. And now, to hear him, and I think you probably heard a little bit of his voice while she was interacting with him, but he's just doing amazing today. And, again, whatever your child's potential is, we want to help you get there. And the quickest way is early intervention. Because the longer we wait, the more challenging it is, the more difficult it is, because not only is your child used to one way of getting things and doing things, you are also used to certain things, like I was sharing with the 10-year-old. However, he actually ended up having friends as well. We initially, because mom didn't have any friends with children his age, so we paid people, to come and play with him. And he actually developed social skills and ended up having friends, which is amazing. And we just had to do what we had to do in the moment, whatever worked. And he actually developed genuine friendships out of that. Because in the beginning, how do you tell a young child, okay, I want you to come and play with this guy? We had to, there had to be we put in an incentive, a motivator, and they all benefited because the typically developing children, they were like, oh my goodness, he is so cool, right? They saw him for who he was and the beauty of him, right? They loved him. His personality was amazing. He just had some skills that needed to be taught. There were just some skills he needed to learn. And he now was like, oh, these people are actually playing with me. Whereas at school, you know, well, he wasn't even in a regular school. This was his only interaction with typically developing peers. So it taught him a whole lot, right? Because it's like my friends can talk to me, whereas at the school they didn't, and which didn't help with the echolalia and all the other challenges that he had until he started interacting with these other children. So super important, because children will learn more from each other than they ever will from us. So it's really important to have them included. Like Marlita said, there was a lot of advocacy going on to get Amir out of those special classes, because what was he learning? Nothing. He was learning, more of this, like this, he was learning behaviors or relearning behaviors that had already been extinguished. He'd already passed those stages. Now he was talking and interacting and being sociable, and didn't have the opportunity to practice with people who could socialize and interact with him. So super, super important. Let's do all we can to get our children, give them the best we can, because, like you, they want to do things, they just don't know how. Right? A lot of people say, well, my child does not like to socialize. Your child does not know how to socialize, right? There's a difference. And we want to teach them. I mean, if you teach them the skill and they choose not to use it, that's okay. At least they know how to, right? It's just like, your child tastes broccoli and doesn't like it, right? But they know what it tastes like now, right? So, and they can choose to say no in a way that's informed as opposed to no because, it just doesn't look like whatever. I know that may not be the best example. However, teaching your child skills and giving them the opportunity to use them and giving them the ability to, how should I put this? They can choose to use it, giving them the right to choose or not to choose to use it or not to use it, right? So yeah, so super important. I hope you enjoyed today and that you got a lot out of it. Marlita's amazing. So glad she was able to join us and just to share from her heart, the journey with Amir. Thank you so much for watching. Blessings.